Thank you very much for inviting me. I'm a really complete beginner in the field of health games. And I had at least 5 ideas to change my talk during this morning. I will talk about the idea how health games could be a chance for psychiatric patients. And this is related somehow to depression, burnout, aging, and so on and so on. Psychic disorders are difficult. Psychic disorders are difficult to understand, but they are especially difficult from the inside. If you have a psychic disorder, and that becomes clear from this picture from an old cathedral of a depressed patient. So depression is not a new disorder, but a very, very old disorder. And as you can see from this plastic, it's not very pleasant. The big challenge for health games in respect to psychic disorders is depression is absolutely no fun. So the challenge is to connect psychic disorders with health games and to find a way for the patients to become interested in health games. The other problem is the stigma. Psychic disorders are stigmatized, and this is a picture from an actor who tried to be a psychiatric patient, and this is the reaction from a student. I wouldn't leave him alone in the same room with my goldfish. So psychiatric patients have a big problem to be accepted by the society. And psychiatric patients, therefore, don't come out with the fact that they have a psychic disorder. Everybody would say, well, psychiatric patients should see an expert, should see a psychiatrist, should see a psychotherapist. And this is right, of course. I'm making my money by being a psychiatrist. But experts are not easy to handle. The first problem for psychiatric patients is that experts are not available. In Kiel, if you have a problem, if you want to see a psychotherapist, you have to wait between 10 and 14 weeks, and that's not acceptable at all. The next point is experts are expensive. And the third and perhaps most important point is that most psychiatric patients have difficulties to go to an expert to say, well, I have a problem, I have suicidal ideas, I don't know how to handle my life, because the fear that the expert will do something unpleasant for them, will send them to a psychiatric ward, and so on and so on. So the situation for psychiatric patients to see an expert is not that easy. Psychiatric patients, we are psychiatric patients because the prevalence for depression is in the range of 40%. That means that each second person in this room perhaps will at least once in their life experience a depression. So we are the psychiatric patients, not somebody else. And the prevalence for anxiety disorder for each single anxiety disorder is in the range of 20%. So it's really a common problem. And psychiatric patients need qualified opinions, and they need them immediately, and not after 3 months when they have problems. My first example is psychoeducation in the case of depression, and that's exactly what our keynote speaker mentioned when he said, communicate and explaining sensitive conditions to patients. What means psychoeducation? Psychoeducation means to answer all these questions here. What is a depression? How does it start? What are the main symptoms? What are my symptoms? How dangerous is a depression? How does it start? How dangerous is it? Depression is a very dangerous disorder. The suicidal rate is in the range of 11%. That's a lot. It's worse than many cancer outcomes. And if you have a depression, the rate of somatic complication of a heart disorder or the likelihood to die from another somatic disorder is increased in the range of 2.5. So it's a dangerous disorder and you have to do something against it. What is the best treatment? There are many discussions in the press. And, should I take drugs or drugs? Do drugs make me dependent? What's the problem? What about psychotherapy? Psychotherapy is not available, and so on and so on and so on. What are the risk factors? Is psychotherapy better than drugs? What is electroconvulsive treatment? So, taken together, all these questions come up with a final question: do I have a depression? And for a patient with a history of depression, it would be very helpful to have an instrument to detect that. Is the depression again coming? What can I do against it? Similar interesting questions are, what about dementia? If I'm 65 and have a depression, then very often I have a cognitive decline, which is reversible, but in this age I can also ask, well, perhaps it's not a depression, perhaps it's a dementia. What about psychosis? Or what about alcoholism? I usually drink 2 glasses of red wine in the evening. Is it critical? Is it not critical? How's the situation? And normally for a patient it's very difficult to find out what critical is. It also depends on the age and on many factors. So, to have a depression, the alternative is, or will I be manic? You all heard about bipolar disorder, about manic depression periods. And usually people say, well, to be manic is fun. First, to be manic, to be on this part of the curve, it looks more funny. But in fact, the mania is a state in which you disturb all your social connections. And in fact, mania is much more difficult to tolerate than depression. And that's a condition which is not, if it's not treated, which is very dangerous for the people, for the social life of people. And even if you have only a single episode of mania, the recovery rate in social respect is around 35%. So most of people lose the job, lose their important relationships, and so on and so on. For many patients, it's very, very difficult to see an expert because they feel so well. They feel so good. Many patients think at the beginning, well, the best stay that I ever had. Why should I see a doctor? And why should I take drugs? There's really no reason. And it would be helpful to have an instrument he could handle, by which he could find out, well, is this a condition which will come up with the next manic episode? Especially for many patients, it would be interesting because many patients don't want to see the doctor. Example 2, burnout. Burnout is an incredible hype at the moment. This is the expression, it found a way into the commercials, especially in the commercials for Schleswig-Holsteinischen Bier. Macht ihr mal eure Work-Life-Balance, ich mache Feierabend. Well, he has no burnout. I have the impression burnout is not the main problem, but most people that come up with burnout have a depression. And you can talk about your depression if you say you have a burnout. Burnout is accepted by the society, depression is not. So if I give a talk about burnout, I have 400 people listening to me. and that wouldn't happen with burnout, because I think in Kiel, in the whole city, there are perhaps 20 patients with a real burnout. What is the problem with burnout? I do what I like and what I always liked and do it a lot, and suddenly it's not funny anymore. I'm not idealistic anymore, I'm a cynic, and so on and so on. I'm overturned. And the easiest way to stop burnout would be to stop working, to start sports, and so on and so on and so on. And that's what nobody can do if he is in a burnout situation. There is an instrument that a friend of mine has detected that's called Goldscape, invented by Marcus Bauer. Perhaps some of you know it. And it's an instrument by which you can handle your time. You can take the different goals you have in your life, and you can give them a certain amount of time, or a certain amount of importance, and so on and so on. And the easiest way to deal with burnout would be if you could take this part of the work-life balance and give them a very important position. And if the work balance is critical coming down, the instrument could say, well, stop it, you can't work anymore, you cannot take any more goals, and so on and so on. That's just one possibility how one could do that. There are many other possibilities, and it would be interesting how that works. Okay, I think the best thing to deal with burnout is shown by this cartoon from the New Yorker. No, Thursday is out. How about never? It's never good for you. Because time is the most powerful resource we have, and the most important resource we have. And we have to decide when we want to stop burnout. We have to decide what we want to do and what we want not to do. Okay, I'm nearly at the end. There are many other issues I could address, but perhaps I can do it the next time. We could talk about aging, anxiety, or disorders. PTSD has been already mentioned. Thank you very much.
Thank you for this presentation. I think it's very relevant, and although you don't mention games, I think there are plenty of ways we could think of linking games to what you're doing. And I also think what I really like in the presentation is that it just touches everyone, and some people think they are not, but they might. And I think there is a way, obviously, to help people in this way. So do you have any question? Is there any question or any suggestion? Okay, yeah.
Are you already developing health games for this kind of disorders? Could you tell something about the state of research concerning the games?
Well, I'm too much in the beginning. The interesting thing would be to test instruments that we developed or other people, and to test them with real patients. And I think we are very much in the beginning in this field. The problem is which instrument would be okay for which diagnosis, for which patients, do the patients accept it? I think in general it's so psychiatric patients can deal with a computer, and they like to do it. It's easier sometimes for them than to deal with man, with an expert, with a psychiatrist. That's a good aspect. The problem is the no fun aspect. So, well, will be interesting.
Thank you. Yes, another question here.
Do you see these games mainly as a diagnostic tool or as a therapeutic tool?
I mentioned mainly the diagnostic aspect because, for For example, depression is very difficult to understand for a patient. I had a patient who was a psychiatrist and he became depressed, and I've seen him, and he wasn't able to recognize that he had a depression. So it makes sense to have instruments for the diagnosis, but it's also very important if you have to take drugs, if you have to make therapy, you can use health games. Or for example, in anxiety disorders, the main therapy in anxiety disorders is confrontation with the things that make you anxious and so on. And you could do that on the regular.
Do you know this web portals like Patients Like Me? It's an American web portal where you can make self-diagnosis when you have a depression or so, and you can get in contact with other patients. Do you know them, and do you think that's the right?
I heard about them. I think that's a very interesting thing, because the possibility to connect you to other people with similar problems, that's a very powerful tool to deal with illness. Question?
Yes.
Now that we have the internet and all those lots of information and so on, do you find that sometimes patients come to you and they have informed themselves about what they might have, but it's not really what you think they might have, or they have read the wrong information and false information? Do you think that their health gifts could help because of somehow limiting that enormous kind of information that's out there on the internet?
Normally, psychiatric patients have no clear idea what's going on. That's the problem. If it's the first episode, if you know the disease, it's very different. So the first step would be to explain the disorder, and health games could be helpful with that too. The other field is that the idea about treatment very often differs between the doctor and the patient. In Germany, a drug has to be green. A drug that has been made from plants is always better than another drug, which is nonsense. So there's a lot of elements to explain what's going on, how is the treatment, how long you should take the drug, and so on and so on. So this is another thing.
How would the patient be introduced to this?
Okay.
How would the patient be introduced to this health scheme, to the diagnostic program? If they haven't had a depression before and they don't know how it feels, how would they know this program?
One step is to explain to patients that that what he experienced is an illness. So the psychiatrist who came to me, I mentioned before, when I asked him, well, tell me what's going on, and he said, well, I don't know. I made something wrong, my life is going in the wrong direction, and so on and so on. And I say, well, that's not true. You have a disease, you have illness. Each student could make the diagnosis, and he couldn't believe me. He said, well, is it true to have a depression? So the information that there is a diagnosis, this is a treatable disorder, this is usually very helpful. And but also there are many ways to come in with health games, because the patient might not believe you as a psychiatrist. He will inform himself. And usually he goes to the internet, and that's helpful. But you need an interactive instrument to come up with the information what's going on with me, personally with me.
So it's the idea to have, let's say, a kind of questionnaire, and based on, let's say, the questions, you will give feedback out of, let's say, the software and the solution, the game.
Yeah.
Okay.
That's one possibility. Yeah.
But what I'm thinking about is how is the connection made between the patient or the possible patient and this health game? How do they get aware of taking the test? Is it by going to a psychiatrist and then know about the...
In the present situation, the normal patient goes to the Hausarzt, to the general practitioner, and then sometimes he say, well, you could go to the psychiatrist. And if we could apply an instrument from health games, yeah, we should start with that and then see what's going on.
We have time for maybe one more question. Is that it? Okay, that's it. Thank you very much.